Hi everyone, welcome back. My name is Lisa Flanders. I am a physiotherapist in Ottawa, Ontario, and I work within women's health and pelvic floor physiotherapy. Today on It's Not TMI, we're going to be talking about how to use a Therawand. Our last couple of videos have been focusing on pelvic pain, including vaginismus, and how to use vaginal dilators, which help to create space in the vaginal opening. And today we're going to talk about a Therawand, which is sort of like the next step tool from using a dilator. A Therawands is a tool that kind of looks like this. It's a little S-shaped instrument. Typically has a thicker end and a thinner end. And we can see that that thicker end is a little bit beveled, so it makes it a little bit easier to insert. And the shape of it actually allows us to insert into the vagina and move the handle to stretch the muscles found within the pelvic floor. This is a great tool to use before or after childbirth to help create length in the pelvic floor. It's also great for those patients who have hip pain or piriformis type syndrome because both the piriformis and some of our other hip muscles are found within the pelvic floor. It's a great tool as well for patients that have pelvic pain, including experiencing painful intercourse or things like endometriosis. And it can be, like I said, a great tool to help relax and lengthen the muscles. So how do we use this tool? Very much like dilators, these come in all sorts of different materials. This one happens to be made out of a medical grade silicone. They come in medical grade acrylics. You'll want to ensure that you're using a lubricant with your Therawand, and you want to make sure that that lubricant is compatible with the material of the wand. And if you need a refresher on the different types of lubricants that there are available on the market, we have a couple really great videos that we've done about lubricant and what materials you can use various lubricants with. So for example, this is silicone. We are going to want to avoid a silicone lubricant with this. Water-based lubricants tend to be the safest for using with different types of tools. So that's the one that I would recommend for this tool. You'll want to lie down on your back in a comfortable position. And essentially your pelvis is then going to be oriented in this direction. You're going to insert your clean Therawand that's been lubricated straight on. So we're going to insert it straight on between the labia into the vagina. So we'll insert the Therawand straight on, and then we're going to rotate the handle and use the handle to be able to access some of the muscles. So just showing from this view, we're going to insert our Therawand straight on. We'll rotate the handle, and then we can use the handle to pull and apply pressure to the muscles within the pelvic floor. We're going to find a tight spot, and once you do, you're going to hold that spot for 1 to 2 minutes, making sure that you're breathing the entire time. Then you'll release the pressure by moving the handle, rotate to a new spot, and apply pressure down again for 1 to 2 minutes, making sure that you're breathing. A couple places that we want to avoid with our Therawand is the 6 o'clock position. So if we look at the pelvis straight on, we want to avoid that position going straight down. You're going to end up hitting the rectum. It's going to feel a little bit uncomfortable if you do that. We also want to avoid the 3 and 9 o'clock positions, so basically side to side. And again, that's just because there's a few bony prominences and it might not be very comfortable. As always, before using a Therawand or other therapeutic tool, consult with your healthcare professional, either your physiotherapist or primary healthcare provider. I really hope that you found this video helpful. And if you have a question that you think might be TMI, feel free to leave it in the comments below, and have a great day.